Now, benign prostatic hyperplasia is a big problem in us men as we age. So this red funnel represents the bladder, and this tube here represents the male urethra, 18 to 20 centimetres long. Now, in youth, the prostate gland is around about the urethra, just the same as it is in older life. So what you need to think of is the prostate gland surrounds the urethra. So the urethra is through here, and the prostate gland surrounds it. The urethra goes through the prostate gland, through the tissues of the gland. So the urethra is surrounded by the prostate gland like that. But in young men, say 20 to 30, even 40 to 45 years old, then there's no enlargement of the prostate gland, because the prostate gland starts enlarging at later life. 45 to 50 years it starts to enlarge. And then men in their 50s and 60s often start to experience the problems caused by the enlarged prostate. So in young men, the urethra, here I've got some freshly collected urine. So the urine will flow through quickly and readily like that. No problem at all. And you can see that our toilet here is filling up with urine quite nicely. But as the prostate gland enlarges, it's going to squeeze on the urethra. It's going to be a pressure on the urethra. So now when we pour the orange in, when our urine tries to go through, there's a resistance, and it only comes through as a little dribble. So we get a much thinner flow compared to the sound that we get with a younger person's flow. Well, that's a nice flow with the patent urethra. Compared to the reduced dribbly flow in the older urethra. So here we see a rounded, fully patent urethra, as we might expect in a young person. But with increasing age, as the prostate gland enlarges, it squeezes on the urethra. And you can see that now makes it go much thinner and slit-like, making it harder for the urine to escape, giving rise to lower urinary tract symptoms. So the prostate gland enlarges with age. This is called benign prostatic hyperplasia. There's an increase in the number of cells present, and it's an increase in the number of the glandular cells in the prostate gland and the stromal cells, the neuromuscular cells, which are in between the glandular cells. Because this, of course, is the function of the prostate gland. What the prostate gland does is it adds part of the seminal fluid into the urethra, ready for ejaculation, so the sperm swim partly in the prostatic secretions as well as other secretions produced by other parts of the genital tract. So the prostate gland is essential. We need it where it is, but as we get old it becomes a problem, because it's partly due to testosterone. The testosterone that men always produce is converted into dihydrotestosterone in the prostate gland, and that causes a stimulation and enlargement of the gland. And it will enlarge out the way, but it also enlarges in the way to squeeze the urethra. So the benign prostatic hyperplasia causes what we call bladder outlet obstruction. The bladder outlet obstruction. So BPH, benign prostatic hyperplasia, leads to BOO, bladder outlet obstruction. And the clinical features that we suffer from with this reduced stream are called lower urinary tract symptoms. So we notice with a normal sized prostate there's no significant pressure on the urethra and the urine flows through readily. No problem at all. But with benign prostatic hyperplasia there's pressure on the urethra, and now we notice that the flow of urine is greatly reduced because of the constriction of the urethra. and as we say, there's a reduced stream, and it's sometimes difficult to initiate urination as well, hesitancy, and that there can be stopping and starting during the stream as well. It might take 2 or 3 attempts at urination to feel that the bladder is moderately empty, or sometimes the bladder doesn't feel empty even after urination. And so urination occurs frequently because of the stimulation of the urine near the base of the bladder, this residual urine that's left in the bladder. And this also gives rise to urgency, where you just need to go to the loo immediately. Urgency, urgent desire to micturate, to void the bladder, to pass urine. The lower urinary tract symptoms, the LUTs, also include nocturia, getting up a few times in the night to go to the loo, because there's incomplete emptying of the bladder. Sometimes we need to strain to try and get the urine out, so-called Valsalva's manoeuvre. Particularly after the stream of urine, there can be residual dribbling, leading to a degree of urinary incontinence. And this can cause, as well as these inconvenient LUT symptoms, there can also be quite serious complications. So, for example, we can get acute urinary retention, where the urine can't get out at all and the bladder will fill up, causing pain and distension of the bladder. There can be urinary tract infections, and particularly in more advanced disease, these become chronic urinary tract infections. Stones are more likely to occur, bladder stones are more likely to occur. There can be increased vascularity of the gland as well, and that can cause bleeding into the urethra, leading to hematuria. Although with hematuria we also need to think about other things such as prostate cancer or bladder cancer. Now, if it's very bad, if there's chronic obstruction, the bladder fills up, and of course the ureters are taking urine into the bladder. And after a period of time, the bladder can't contain all the urine, and the urine starts flooding back into the ureters. This is called hydroureter. And after a period of time, the urine can dam all the way back to the kidneys. That's called hydronephrosis. And hydronephrosis will lead to chronic pyelonephritis, infection of the kidney, destruction of the renal tissue, and complete renal failure. So you quite possibly, without treatment, someone can die of benign prostatic hyperplasia. So remember, the BPH leads to the BOO, leads to the LUTs, and it's all caused by this obstruction of the prostate gland, or the prostate gland obstructing the urethra. There are treatments for it. I mean, we can give some medications. There's medical treatments that can be given. The gold standard treatment is actually what we call TURP, transurethral resection of the prostate, where a diathermy is placed up the urethra to the level of the prostate gland with a cystoscope, and then the prostate gland can be paired out with cutting diathermy, heated cutting diathermy from the inside, and that gives very good results. So sometimes that sort of treatment is necessary. But you could say that this is the world's most common medical condition because it's going to affect all men. So if you're a man watching this video, I do hope you live long enough to develop benign prostatic hyperplasia, because in time you're going to. 80 or 90% of men in their 80s will have symptoms, becoming more common after the early 50s. Progressively more common as the prostate gland increases with age. Now, lower urinary tract symptoms can be caused by other conditions as well as benign prostatic hyperplasia, because benign, by definition, is non-malignant. And unfortunately, prostate cancer is the most common cancer in men. So there can be a malignancy in the prostate as well. Now, very often, the benign prostatic hyperplasia affects the parts of the prostate gland nearest to the urethra. So the lower urinary tract symptoms often come on fairly early in the disease process. Not necessarily so with prostate cancer. But it's true to say that prostate cancer can cause identical lower urinary tract symptoms to benign prostatic hyperplasia. So the difference between benign prostatic hyperplasia and malignancy of the prostate always needs to be diagnosed. One of the things we do is test for prostate-specific antigen. In all men, the prostate-specific antigen will increase with age, but in malignancy there can be quite a significant increase in prostate-specific antigen, the PSA test. But that is only a guide, of course. If the PSA was raised in combination with lower urinary tract symptoms, we need to palpate the prostate. So basically it's a glove finger into the rectum. The prostate gland is anterior, and in benign prostatic hyperplasia it can be palpated through the wall of the rectum, often enlarged. The enlargement can be felt, but the key thing is the surface of the gland feels soft, not soft, more rubberish. Feels rubbery, but it's smooth, it's not lumpy. Whereas in malignancy we can get bits of tumour which are lumpy sticking up, giving a lumpy feel to the gland, and especially hardness. If it feels hard, that's a stronger indication for malignancy, because tumours are irregular and they are hard if they are malignant. And then of course we would refer the patient fairly quickly straight away for a biopsy of the prostate, and then appropriate radiotherapy or surgical treatment, or whatever particular treatment the oncologist likes at the time to treat the malignant condition. At the moment, the results with radiotherapy for early prostate cancer are good, as indeed are some of the surgical options. So there's plenty we can do, but like all cancers, we need to catch it early. So hopefully most of you men watching won't get prostate cancer. There's nothing I can do to stop you getting benign prostatic hyperplasia as you get older. No, we don't really know what causes it. We know this is hormonal cause, but I'm afraid I can't give you any specific advice to prevent it. But I would advise you a good diet and plenty of exercise, plenty of fruit and vegetables, because we know that things like tomatoes and good nutrition will somewhat reduce the possibility of you getting cancer of the prostate, which of course is good. So with a patent urethra in a younger person, we notice that the urine flows out with a good stream, no problem at all. Whereas with the older person, because there is constriction of the urethra, we notice that the stream of urine is greatly reduced, might be intermittent, incomplete emptying, some dribbling at the end of the stream. Much more prolonged process for a lower total volume of urine being passed.